start. Hi, welcome to the webinar for HPGS, Hawaii Pacific Gerontological Society. The HPGS was actually founded in 1979. It was organized specifically so that it could help to improve the quality of life for Hawaii's older adults. And we have been starting a program this year where the last Thursday of every month we do webinars that are specifically geared for the aging ones and to assist in just continuing on with whatever will help them to have a better, more effective life for themselves. And so we really encourage you to join us every Thursday, or not every Thursday, the last Thursday of every month for the webinars. This month, actually, we are going to be talking about taking care of the caregiver. And we're going to be talking about the stress levels that the caregiver does experience and how that they can be assisted. And so what I wanted to do just a little bit for now, first of all, I am Pamela Ah-Nee. I am founder and director of CG Refresh and Renew, which is a program that's been set up to assist caregivers in seeing their situations perhaps a little different than the way they are presently seeing them, which is overwhelming stress, definitely. But the effects of stress sometimes is not fully recognized, and that's what we want to talk about. We want to talk about being able to go in and exactly what is it that a caregiver is experiencing, and then what can we do to help the caregivers. But in case you want to go back and see this webinar, it is going to be put on YouTube, and you can even go back into YouTube to see previous webinars. And we really encourage you to do that. You go to hpgs.org for your connections. Also, we encourage you, if you have not become a member, please do so. Please consider becoming a member of the Hawaii Pacific Gerontological Society so that we can continue in assisting our aging population in just being able to give them a better life, and so give supportive services. Just being able to, even going in with legislation, where being able to help them age with dignity and with grace, and that's what we want to give to them. But getting back to the caregivers at this point, nearly everyone that we know does experience stress at some time. We know that when stress is felt, that stress will produce changes in many of our body systems, including our heart rate, our blood pressure. It can alter our immune system. And to a degree, some amount of stress is very healthy, but excessive stress, stress that's been left untreated, it will lead to anxiety, which will also lead to illness. Stress will affect people in some way, somehow. There's always going to be a physical reaction to the stress. Acute stress will, which is something that is brought on with sudden or some short-term experience, that will immediately bring on a rapid change throughout the entire body. Almost all of the body systems, the heart, the blood vessels, the immune system, the lungs, the digestive system, the sensory organs, the brains, will gear up to meet what is a perceived danger. Now, these stress responses definitely can prove beneficial in a very critical life or death situation. However, over time, when these stressful situations put a strain on the body, it contributes to the physical and the psychological components or challenges. Chronic, or what we call long-term stress, can have real health consequences, and it needs to be addressed as if it would be any other health concern. Matter of fact, caregiver stress is now an official diagnosis And so we know that this is something that needs to be dealt with whenever we see the situations beginning to come up. Now, with probably the best way to explain this is if you bring in the what we call the being chased by the bear scenario. If you see a bear coming at you, you're going to have a physical response, not only just in trying to run away, but there's going to be actually a body reaction to that stress. There's going to be the release of a steroid hormones, or the stress hormone, which is called cortisol. Cortisol is very important in helping to organize your systems throughout the body, the heart, the lungs, the circulation, your metabolism, your immune systems, your skin. But when this happens, it is supposed to be only temporary, just to deal with that one instant right there, that the bear is now coming at you, and your body needs to get into a place where it can deal with that bear coming at you. There's also the release of adrenaline, that it activates an area inside the brain, the amygdala part, where it appears to trigger that response to that stressful event. And in this case, with the bear, it's going to trigger most likely fear, or it would for the most of us anyway. And then you've got your release of your neuropeptides. The neuropeptides, it's a protein that modulates the stress by decreasing sleep and increasing alertness and a sense of anxiety. And again, this is to assist the person in the urgency of running away from that bear. And then you have the effects on your long and short-term memory during a stressful event. These things are suppressed. It'll suppress the activity in areas at the front of the brain, the frontal lobe, which has to do with our short-term memory, concentration, inhibition, our rational thought. Now, what it helps with the bear coming at you, because the sequence of mental events allows the person to react quickly to either fight or to flight. And preferably we want to run from that bear. We want to fight. But it also interferes with the ability, or maybe I should say inability, to handle social and intellectual tasks and behaviors at that time, feeling this effect. Then you've got one more element, and that is that the neurotransmitters signal to the hippocampus, which is another part of the brain, to store that emotionally loaded experience into what's called long-term memory. Now, this is critical with the bear because it's going to hopefully assist in avoiding these threats in the future. Now, some of the research that has been done, it's finding out that during these times of stress, the nerve cells in the brain interpret the chemical signals incorrectly. Instead of switching off, these nerve cells perceive the signals as telling them to switch on. And it's as though the brain's brakes literally fell in response to the stress. So as the bear comes closer, the heart rate, the blood pressure increase instantly, breathing becomes rapid, the lungs take in more oxygen, spleen discharges red and white blood cells, allowing the blood to transport more oxygen throughout the body. And it's also estimated that the blood flow will actually increase 300 to 400%, trying to prime the muscles and the lungs and the brains for the added demands that's coming. Now, why did I say all of that? Whenever there is ongoing acute stressors, our body locks into that, and we now begin to experience chronic stress response. So rather than our bodies responding to just the bear that's coming at us. It's as if we are in perpetual run mode. And this is one of the things that I do want us to talk about today. With CG Refresh and Renew, here we're providing therapy and resources for the caregivers, for families of age-related dementia patients. We're providing consultation for businesses and professionals who are also working with seniors. We are also assisting the families in going in and setting up monitoring systems so that they can look in on their loved one if they're not there physically with them. Let me back up just a little bit. Let me talk about Alzheimer's and age-related dementia. Alzheimer's is the most common form of dementia. Dementia is just a general term for memory loss. The question I get asked most is, what's the difference between Alzheimer's and dementia? Well, dementia is your umbrella. Alzheimer's is one of the diseases that comes under that umbrella. Dementia is just, again, it's just a term for memory loss. The Alzheimer's disease does account for about 60 to 80% of dementia cases. However, one of the other things that we are finding out is that there are very few cases that is Alzheimer's exclusively. We're finding out that many people have a dual diagnosis. So you have your Parkinson's and Alzheimer's mixed. You can have your Lewy body disease with Alzheimer's. So you have this mixture. Alzheimer's is not a normal part of aging. I know one of the things that we hear, oh, I'm just getting older. Well, it's not normal. 200,000 Americans under the age of 65 have what's called younger onset Alzheimer's disease. And that is where even at the early age of late 30s, we're finding out that people can be diagnosed with Alzheimer's. Alzheimer's has no current cure. There are treatments for symptoms that there are available now, but the research continues. Those with Alzheimer's live an average of about 8 to 13 years. However, they usually host it about 4 to 5 years before it is evident. So then you've got your 8 years of being able to be with your loved one after that. The stages of Alzheimer's basically is that in the early stage, problems coming up with the right word or name, trouble remembering names when introduced to new people, challenges performing tasks that were very well known and now they can no longer follow those patterns, forgetting material that one has just read, so losing their comprehension, losing or misplacing a valuable object, increasing trouble with planning and organizing. Then you get into what's called your middle stages. So the forgetfulness of events, forgetting your own personal history, feeling moody, feeling withdrawn, being unable to recall the personal address or telephone number, not remembering the name of the high school or the college from which they graduated, confusion about where they are, confusion about what day it is, the need for help choosing proper clothing for the season, trouble controlling bladder and bowels in some individuals at this middle stage, the need for changes, the changes that come in the sleep patterns, such as sleeping during the day, becoming restless at night, and the increased risk of wandering and becoming lost. So there's a need of being able to monitor them at all times. Personality and behavior changes, it includes suspiciousness, delusions, compulsive behavior, repetitive behavior such as hand-wringing, tissue shredding. This is all part of your middle stage. And then you have what's called the end stage or the late stage of the Alzheimer's disease. This is when our loved one is needing around-the-clock assistance with daily activities, personal care. They lose awareness of recent experiences. They can probably tell you all about the war, but they don't remember what they had for breakfast. Or in many cases, they don't even remember that they had breakfast this morning. Experiences changes in physical abilities, including the ability to walk, to sit, and then at the end, not being able to swallow. But that, what we call that little Alzheimer's shuffle that kicks in at this late stage. And then, of course, having increasing difficulty communication and getting to the place where they most likely are not communicating at all. They're listening, they're just not talking back, or if they do, it's not making a lot of sense. They're not able to put things into words. And they are highly, highly vulnerable to infections, especially pneumonia and UTI. The urinary tract infections are very common in the late stages of the Alzheimer's disease. So stating all of that, what would the caregiver's needs be? I know we recognize what needs to be accomplished and what needs to be done for the patient, but what about the caregiver? They need help in being able to regulate some of those cuckoo behaviors. They need to know how to communicate with their loved one. What type of activities could the caregiver do with their loved one? How does the caregiver go about getting respite care? And the caregiver also will, in many cases, experience memory loss. So how do they retain their own sense of self? The caregiver also needs help with dealing with legal matters. What are the care options? What happens if it gets to the place where I am no longer able to take care of my loved one? What are my options? How do I pay for this? Who's going to help with this? What are the safety concerns that I need to be aware of? And then, that big one is dad wants to keep driving. How do we get the keys away from him and deal with the dementia and the driving? So for Hawaii alone, the projections of your total numbers in Hawaii with Alzheimer's right now is 27,000. Now, you have to understand, in the state of Hawaii, it is not required that this diagnosis go into medical records. So we are thinking, just from what we know verbally, that this is probably only about 40% of people who actually have Alzheimer's. But it is increasing. It's going to be on the right now. It's like 1 out of every 6 been diagnosed with Alzheimer's disease above the age of 70. In the next 5 to 7 years, it's going to be actually 1 out of every 3 people diagnosed if we do not get a cure. And this is why one of the fears we always said is, I have a fear that either I will be diagnosed with Alzheimer's disease or I will have the responsibility of being a caregiver to one of my loved ones. So by 2025, we are looking with at least 35,000 people in the state of Hawaii, and that means people needing a caregiver. 3 primary reasons that caregivers decide to provide the care and assistance to a person with Alzheimer's and keep them at home rather than placement is 65% have the desire to keep the family member or the family friend at home with the acquaintances that they are aware of. 48% choose to keep them at home because they want to remain within the proximity to the person with dementia. And then 38% keep their loved one at home because they perceive that it is their obligation as a spouse or a partner or even a family member. It's been estimated that in the state of Hawaii, there are 66,000 hours of unpaid care given by caregivers. 75 million hours of care, just going around the clock, adding everybody's hours together. $915 million value of unpaid care, with $42 million of healthcare cost for the caregivers themselves. We're finding out that 53% of Hawaii's registered voters aged 45 and above are currently providing or have provided unpaid care to an adult loved one who is either ill or frail, elderly, or has some type of a physical or mental disability. 92% of those caregivers also believed it was important to be able to provide care so that their loved one can keep living in their home as long as possible. Just to give you some really quick percentages, which were, for me, when I was looking at this, I said, wow, I just never saw it in the amount of figures. But for Hawaii caregivers, 86% of them do the shopping, 85% provide transportation, 83% provide the meals or cook the meals or organize the meals. 82% of them are also doing household chores for their loved one. 72% of them are doing the medication management, making sure it's organized, making sure mom didn't take too much medicine or making sure mom took the medicine she's supposed to take. 70% of them give other nursing and medical tasks as well, whether it be changing a wound, changing diapers, etc. 64% of caregivers actually manage the finances, and 53% of them actually do the bathing and dressing of their loved one. And when you look at these, and I don't want to spend all my time going through these, you can go through them and just read here, but it's just interesting to note of the percentage. The average age of Hawaii caregiver is 62 years old. And 58% of them have an annual household income less than $100,000 a year. And this is startling in light of the fact that the caregiver themselves quite often are required to quit their full-time job so they can take on the full-time position of being a caregiver, which means in addition to them not having income, they also do not have health care for themselves. 63% of them have reported feeling emotionally stressed, just in general, just that persistent feeling of being overwhelmed. Over 50% of them have reported difficulty in not being able to get enough rest. It says here that 29% report having experienced health problems. That, those are just the ones that's reported it, because we know that our body is going to react to stress. So there's going to be health issues, and many of them not reported. Caregiver Syndrome is a real diagnosis. I used to always report, because of a study that had been done earlier, that 40% of caregivers actually end up in the hospital before their loved one does. But then Baltimore, Maryland came out with a study just recently, and their study is saying now that 70% of caregivers will pass on before their loved one does. It is a real diagnosis. Caregiver syndrome is an accepted diagnosis. And the sad part is the caregivers often don't seek help because they don't even realize that they have what's called a recognizable condition. Many of them feel like nobody really understands. But caregiver stress has been found to be the leading cause of high blood pressure, diabetes, and then also the compromised immune system, which means they catch all the flus and the bugs that's coming around. A person caring for somebody with dementia will often develop progressive memory loss themselves. And that is because they are so much in their loved ones' Cocoa Pops that they lose sight of even themselves and what's important to them. Elderly caregivers are at a 63% higher risk of mortality than the non-caregivers. And we have also found that the exhausted caregivers' stress hormones are similar to those who are suffering from PTSD, or the post-traumatic stress disorder. And I read to you earlier about that acute stress and what happens in those hormones. The effects of stress on the body: headaches, frequent infections, the tightness, muscles, spasms, twitches, fatigue, skin irritations, feeling out of breath, mentally worrying, having what's called muddled thinking, impaired judgment, nightmares, literally bad dreams at night that wake them up, being indecisive, being negative, not being able to find the positives of life, making hasty decisions, and quite often those impulse decisions aren't in the best interest of them or their loved one. We're finding that caregivers are more accident prone because of the effects of stress in their body. They lose their appetite. loss of sexual drive, so there's not the intimacy that's needed there, drinking more alcohol, insomnia, restlessness, smoking. These are all things that they, and eating more and eating on the run, which means they're not making the best decisions in what should be done for them on a health level. Emotionally, the loss of confidence because they just feel they can't do it, and they don't realize very few people can. Being irritable, being sad, overwhelmingly sad, and just feeling alienated. And of course, just that whole feeling of apprehension. What's going to happen next? How do I deal with that? So what can be done? What can the caregiver do? Well, anger, denial, depression, fear, all of these emotions follow the diagnosis. And for some people, it's like, okay, I may be feeling this, but I need to just suck it up. I need to be strong. But it's important that the caregiver is open and they're honest about their feelings and they seek help, because there's no way the caregiver can do this on their own. They need to change their own eating habits, especially if they've been eating on the run and they find themselves eating things that aren't the best. They need to be eating more fresh fruits, more vegetables, eating more fish, eating a lot of nuts for the protein. We're also finding out that this is one of the few things that will slow the progression of the disease for the loved one, and keeping your immune system strong as a caregiver also. Physical and mental exercise is so desperately needed for the well-being. We're also finding out this can help to slow down some of the progression. So it's really important to incorporate them not only into the caregiver routine, but to have something with the routine also for the loved one with the dementia. With CG Refresh and Renew, we do offer classes for the caregivers. We go into the homes, we assist in putting in monitoring systems so that they can look in and monitor their loved one. We are able to assist with GPS trackers, so if the loved one would walk away, pull them up on via a GPS system and see right where they're at. With that monitoring system, the family can receive text alerts even if they're thousands of miles away to know that their loved one is eating, they're taking their meds, they're using the restroom, they're getting out of bed. And these text alerts are actually sent in real time with the tracker or the GPS pending. Track the location of their loved one using the web, using the smartphone. And there's also an emergency SOS button in there which would immediately connect the user with an emergency care specialist. Going in and putting in a monitoring system, putting in cameras where family members can actually see their loved one and see them on their smartphone or their tablet, and even in some cases be able to communicate with them through those cameras. Some of the things that is needed desperately for the caregiver is dealing with those behavior changes. Now, you're not going to change the loved one, but you can manage those tough situations, and you can learn to manage the stress by changing some of the thought patterns and the habits of the caregiver themselves to change. It's important the caregiver shares their expectations with others. It's important that that caregiver don't become arrogant and cocky, because then you're going to lose your support system. But you do need to be more assertive. You do need to be able to say to others around you, I need help. I can't do this on my own. You need to exercise more as the caregiver. The caregiver needs to be eating healthy foods. They need to focus on positive relationships for themselves. Again, sharing their feelings, listening to others, become part of a support group, find a group of other caregivers. Some of the resources that you can look at as well is the State of Hawaii Department of Health Executive Office on Aging, agingcare.com, which is an LLC. It's wonderful, wonderful material. The Alzheimer's Association, of course, of which I was a part of for a little over 4 years. The Hawaii Community Foundation has a section caring for our kapuna. The University of Maryland Medical Center has done a huge thing on stress, and that's where I got a lot of my information from, their resource that they had presented. the National Institute of Mental Health, the American Institute of Stress, the American Psychological Association has wonderful, wonderful information as well. Here locally, again, finding information with the Alzheimer's Association. There's also another group called the Alzheimer's Foundation. There is a wonderful, Annette Pang, I believe she did the March webinar for us. She has, she does family caregiving coaching. Whenever our loved one is diagnosed with a dementia of some sort, you will be surprised what type of family dynamics come out of the woodwork. And so Annette has just a wonderful way of going in and being able to deal with those family dynamics, bringing them back together so that they can be a support from each other rather than allowing the disease to be the grounds on which they are now working separate from each other. But I wanted to just take a few minutes, and if I can, and I just wanted to, we said that the caregiver stress is not something that is always noted. So if you have a loved one with dementia and you have another family member who is going in and taking care, you want to make sure somebody else is helping to watch over the caregiver. It doesn't have to be something where you're, you know, constantly, how are you? What you doing? Are you okay? Are you taking care of yourself? But you do need to be checking in periodically. And the 10 most common symptoms of caregiver stress would be your depression, withdrawing, no longer going out with friends, insomnia, not being able to get enough rest, trouble concentrating, easily becoming angry or frustrated or upset, health issues, exhaustion, anxiety, heavy drinking alcohol, smoking, and the altered eating habits. These are your top 10 symptoms of actual caregiver stress. And one of the things that the Utah State University has actually come up with in their recent research, they found a very significant link between the stress management strategies of the caregiver and the mental functioning of the person that they are caring for. And when they went in with the percentage, they found out that the caregivers who actually adopt what is called a problem-focused approach to solving some of the most common caregiving challenges, not only experienced greater personal health for themselves, but they were also able to provide better care for their loved ones with dementia. And in this entire study, they proved that the caregivers who had adopted this problem-focused approach actually was able to slow down the mental decline of their loved one by 37%. And that is an overwhelming figure, over a third. And just to know that caregivers can actually have a direct effect on the one that they're caring for positively if they will learn how to deal with their challenges from what we call a problem-focused technique. So this would include removing themselves from the presence of the stress, or seeking to understand and coming up with a plan to tackle that stressful situation. So, for example, if your loved one suddenly becomes agitated and starts pacing around the house, a problem-focused strategy would begin with research into the possible causes of that anxiety and the restlessness in someone with dementia. Understanding that when somebody is pacing and walking, it's because something is going on. They just don't have the words, and they don't have the ability to express what's happening with them. They might need to actually go to the bathroom and they can't say it, they're just pacing. Or they might be cold, or they might be hungry. They might be in pain and they can't tell you what hurts and what doesn't hurt. So your first priority as a caregiver, of course, would be to calm them down by either removing the cause of their agitation or distracting them with another activity. And after their anxiety has passed, then you want to brainstorm ways to avoid the anxiety producing situation in the future. And I know this almost sounds like a complex system, but it's proven that going in and being able to be more problem focused rather than just reacting to a problem will not only help the caregiver to retain their sense of well-being, but it can also slow down the progression of the memory loss by 37% for the loved one, simply the way the caregiver is acting or reacting. So the whole idea of being able to be in control not only of your own emotions, but knowing to some degree you can have control of slowing down that disease. It's just, and it's phenomenal. And the results are phenomenal as well. But now, just in closing, I want to share 4 things with you. There are 4 ways to handle, healthy ways to handle being a caregiver, a family caregiver. And number 1 is you got to obey what we call the caregiver golden rule. And I bet you can probably guess what that one is. You've got to put your own oxygen mask on first. You have got to know that taking a problem-oriented approach to caregiving also includes being aware of your own physical and emotional needs. You need to have scheduled personal hours where you're able to just breathe for a little bit on your own. Not only hours, but one of the things I always tell caregivers, every 6 to 7 weeks, you need to schedule a weekend away where you have somebody else coming in to take care of that loved one, and you get away, or else you have somebody coming in to take care of the loved one, and you just step back from having that responsibility for a couple of days, just to give yourself time to refresh, to renew. Remembering 70% of you can end up in the hospital before your loved one does. If you happen to go into the hospital or become ill or even pass away, your family is now left with 2 people to care for. And you've got to remember to take care of yourself. Not only for you, you got to take care of yourself for your loved one and for your family members as well. Also, just learning how to go with the flow. Everyone has their bad days. Everyone has their good days. Be okay with your own bad days. Be okay, be wonderful with the good days. But also recognize that your loved one has good days, bad days. If you can just try to figure out what is triggering those bad days for your loved ones, that'll be part of your battle as well. And you feel like you're in more control and not out of control with it. Start writing down a log. Get one of those marble composition books, because it doesn't have pages to tear out so easily. And you just want to write down at the end of the day or even during the day what has worked, what didn't work so well. Share it with other family members. Get other family members to talk to you about what works for them. Also, joining a support group, finding out from that support group what has worked. Jot them down in your journal. And this way you can have something else to refer back to when these issues pop up. Educate yourself. Don't ever, ever stop learning. I have 2 master's degrees. I have a certification in dementia as a dementia practitioner. I am every single day going in and trying to read something new, finding out new things and new approaches, finding out information for family caregivers. Don't ever stop. Be the professional student. Be the perpetual student. Always be learning about the disease. Always be learning about the caregiving aspect of it. And then the last one almost sounds a little humorous, but you need to find meaning in the madness. It is there. Studies have shown that caregivers who are able to derive meaning and purpose from their experiences find the burden of caring for a loved one to be much lighter than those who have viewed the experience through just predominantly a negative perspective. I'm doing this because I have to. No, you don't have to. If you're having trouble finding the positive aspect, again, look at journaling. Start a journal and chronic all the beneficial experiences and insights that you've gained from your caregiving journey, and then be able to share that with other people who may need your perspective. But for additional information on coping with the stress and avoiding burnout, maintaining your own sanity while taking care of your loved one with Alzheimer's, don't hesitate to call me, 291-5185. I personally have 2 offices. I have one in Honolulu, one in Hilo. And so anything that I travel back and forth between the 2 islands, but that one number goes with me in both places. So you can reach me at any time. Again, being able to get in contact with Annette Pang, you can contact me and I can get you in touch with her as well. The CG Refresh and Renew website will be up soon. That's presently in the process of being made. I have the domain. We're just creating now the articles, but hopefully we'll be able to get more things up there that you can view as well. HPGS is putting together resources, so anything that we can do as well to help you, please don't hesitate to call us. But just for today, again, anything that we can do to be of assistance, don't hesitate to ask. And if there are any questions at this time, I'll take just a minute. You're more than welcome to go into your Q&A part and type them in. Or I believe there was supposed to be a mechanism where you can actually come in and ask the question verbally, and I don't see that right now on my screen, that you can type one in if you do have a question. If not, I am so thankful that I was able to be a part of today with you, and hope that you remain well, be refreshed by renewing your mind, and we will catch up again soon. Make sure you go in to see this again in the YouTube or refer it out to other people as well. Have a great day. God bless.